Did you want to check any of these
If
products?
we could check
Okay.
them all, I'd like that very much to see.
These you've never opened though.
Right, that's true. I got these from a scientist here in Maui just yesterday, and anyway, the guy is brilliant, and I'm looking forward to trying them. They're suppositories, so they should be assimilated really well. So and the guy's a brilliant guy. He's done a lot of research, and so I'm hoping to find if these are going to be a product that we will be carrying. But I will be, spending some time using them on myself, and I have 2 daughters with breast cancer that's recently developed, and I'm really struggling trying to get them to use the MMS and the silver and some of the other things that I've been using very successfully because they both believe in MDs. And so far, they're pretty well following the protocol that the MDs laid out for them. And I know that my one daughter's already opted for surgery, which, it's not my place to tell her what to do. I'm just trying to educate her.
And give her choices.
Exactly.
Right.
And I'm hoping that some of these things will help detox and cleanse her. And all of these are very powerful. All 4 of these products, very powerful cleansers.
Well, to really test these, we would need to cut one of these open. You want to not do that?
No.
You want to do that?
Sure.
Because then we could leave those here because they're open, and then we could.
Sure.
That way we can test them for you too.
Absolutely.
So if I just go with this one, and I don't need much. I just got a knife here, but if we test it, so in a sense, it's now exposed where we can see it.
Yeah.
That's all it takes.
Yeah.
So now we know, is that going to be a test? Is that testable? And let me see. Yes. Okay. Each one are labeled, so I can. If we have several in my hand, we're not going to make a mistake that way. That's what I want to look at. If we pull this one off, and we test it. If I check this for you, this product, I already know you're not reversed. I want to be healthy. I want to be sick. Okay. This product, I want to be healthy. This product, I want to be sick. Would this be helpful to you? Yes. Significantly. Very significantly. You should do more than 1 a day? No. So the body's going to tell you, you should do every day? No. Every second day? No. Every third day? Yes. Okay. That's how quickly you get the information. The nice thing is, I can access your daughter's field through you because you know her. So let's just use a first name on one of your daughters, if that's, or even it doesn't matter.
Okay, Lori.
If we check Lori, I want to be healthy, I want to be sick. She's not reversed. So if we check for her, this product I want to be healthy. This product I want to be sick. Okay. Would this be significantly helpful for her? Yes. Very significantly helpful? Yes. If we want to rate things and say, the ideal thing would be a 10. Is this more than a 5? More than a 7? More than a 9? Is this a 10? Yes. That's pretty good. It's a 10 out of 10.
How do you get better?
Right. Yeah, and you could say every day? No. Every second day? No. Every third day? Yes. So, that's important information because then, and that's what what you're going to move toward is having a picture where people can test your website from a picture.
Okay.
They're only buying things that really work. I know you. You don't want to have something that doesn't work.
Exactly.
You're not looking at, multi-level marketing, buy this the rest of your life whether you need it or not. That's not what you're about.
Exactly.
Yeah. So that one tests very significantly.
And what is that?
That is this one.
Let's see.
Now, and again, you said these were glutathione, which are a very powerful, antioxidant. But if we check about, the other person you're thinking about, I want to be healthy, I want to be sick. So I always make sure they're not reversed. And I'm always holding this, otherwise I can't trust my answers.
Right.
And another thing I'll often ask for remote is, do I have permission for this? Yes. Okay. I'm really asking energetically, does their higher self give me permission? Mm-hmm. So then if I check for her, this product I want to be healthy, this product I want to be sick, okay? Would this be helpful? Yes. Significantly helpful? Yes. Let's ask. More than a 5? More than an 8? More than a 9? More than a 10? So again, for both of them, this is a 10 of 10. And we'll check it. Every day? No. Every second day? No. Every third day? Yes. So you can see how quickly you can tailor something for them. If we choose another one, and I'll just open this up, because then you have a way of comparing, and that's the nice thing, when you have those pictures on the website where somebody can say, well, maybe you've got 20 great products that they test good on, and they're trying to decide which one, they can only afford 3. Where should they go? Well, they have the ability to go in and rate them and say, okay, is this one better? And by doing that, it gives them a freedom, to then leverage their treatment dollars. So this one is, I'll let you pronounce it.
Okay.
I have my glasses on. Yeah.
Glytamins.
Okay.
Okay, and this is a detox as well.
Okay.
All of these are detoxing, and I'm trying to remember. This glycine, I don't know. I don't remember. I normally write notes down on all this, and it's this is a kidney. Okay.
And gallbladder.
Kidney and gallbladder detox.
Okay.
Okay. And like I said, this guy is one of the most knowledgeable people I've ever run into. He really does his research and spent years developing these formulas and the delivery system. So I know that I first took his first product 11 years ago. So I met the guy a long time ago. And not that we've stayed close, but I know he's been around. He's been here on Maui for like 11 years. And that was, I met him when he first got started.
Well, I'm not familiar with his products yet, but one of the things I do like about them is they don't have 50 ingredients. And when you have somebody that's very sensitive, and there's a couple of great companies that they make a supplement that has 25 or 30 different plant sources, at least my population can rarely take that. And this is what breaks down stones, both kidney stones, gallstones. I'm trying to remember the herb that comes in that.
Chanca piedra.
There we go. I still have trouble saying it.
Chanca piedra.
Chanca piedra, yeah.
Breakstone.
Breakstone, that's a little easier one for me. But if we look at that, now that we have a little cut in it,
Yeah.
okay, and we just, again, if we hold the belly and we think about Lori, I want to be healthy, I want to be sick. If we check it for her, this product I want to be healthy, this product I want to be sick. Okay, good. Is this helpful? Yes. Significantly? Yes. Okay, is this more than a 5, more than a 6, more than a 7? Okay, so this one's a 7 of 10. Okay, is this as helpful to her as the previous product? No. So that way, if somebody says, well, I only do 2 things, okay, well, we know 2 that are okay.
Well, ask it while you've got it there if that's going to be for myself as well.
So let's check that. Testing for Dennis. I want to be healthy. I want to be sick. You always make sure you're not reversed. So that product you want to be healthy. That product you want to be sick. Okay, would that be helpful to you? Yes. Significantly, yes. Okay, for the issues you're working with, is it more than an 8? Is it more than a 9? Is it more than a 10? Yes. Okay, so for you it's a 10 of 10. So for your health issues, the way your body's prioritizing it, it's that's pretty important for you.
Okay.
Okay, should you do it every day, every second day, every third day? So it looks like, again, every third day.
Okay. That's great.
See, and I think one of the things that's so important with that, what people don't realize is that, I have a postdoc in psychopharmacology. And so if you have depression and you go to a Western physician and they have these 25 medications to try you on, there's no test to say which is better. The best test they've got is, do you have a family member that took one of them and got better? If you don't, it's literally which one's getting the biggest bonus from the pharmaceutical reps, what they push, or what's the side effect profile. If you're not sleeping, then let's give you something that's very sedating. If you're very thin, it'll help you gain weight. If you're overweight, they'll give you something that messes with your appetite. But they don't have any way of knowing. If you sit down and talk to a pharmacist or look at a PDR and you test yourself, you can go in there and say, I think these are the best ones that test good for me. Unless he's got a reason not to, you're going to hit a home run from the beginning. And whether that's a prescription that you work with your doctor on, or whether that's natural supplements, you have a way of testing for you at that time what's best.